I saw a post on Facebook with this caption that a pregnant woman died in a maternity hospital in the north because the staff refused to accept bank transfer. They insisted on collecting cash because they were to pay for oxygen. When I saw the caption, I was like, I'm not sure if the hospital is a government hospital, or if the hospital happens to be a government hospital, I'll say it's not possible. Why? Because in government hospital, if a patient comes in with respiratory distress, or patient comes in and after assessing the patient, it's been discovered that the patient will benefit from oxygen. Nobody will ask the relative to go and pay before the commencement of oxygen. Nobody will ask the relative to go and pay before the commencement of oxygen. In fact, the patient will be rushed into the ER. Oxygen will commence immediately, and the only thing they will ask them to get is probably the nasal crown or the non-removable face mask, if that is what the patient would need. And if it's not available, they will ask them to get it from the hospital pharmacy. That's if the hospital pharmacy is working at that time. There is nobody that will delay patients' access to oxygen because they insist on them paying with cash and not bank transfer. I'm going to attach the screenshot of the post to this video. So if you know the hospital, I would appreciate if you could drop a comment in the comment section. Is maternity and children hospital in the north, and I'm not really sure if it's a government hospital or not, but this is what's obtainable in the government hospital. I don't really know how things work in the private hospital. Probably they will have to pay first before the administration of oxygen. But as far as government hospital is concerned and saving of lives is concerned, the administration of the oxygen will be commenced ASAP. What I'm concerned about instead is the fact that oftentimes when a patient comes in like that, as a case of emergency, after giving the necessary care and the patient becomes stable, we ask some of these relatives to pay for the services rendered, like the oxygen that was given initially without asking them to pay. By the time the patient is stable and you ask them to pay, I'm telling you, it's going to be a different story entirely. Some of them will go as far as saying that you have not done anything for this person. We don't have money. And most times, when these people don't have money, that is when they will try to pick up fights with you. All the services that have been rendered initially will be considered as nothing, and they will pick up a fight because they don't want to pay. They don't want to pay. So for private hospitals that insist that patients should pay before we are being attended to, I don't blame them, because how many patients do they want to attend to without getting money from them? How do you expect them to continue to run the hospital? They will run into debt. So I don't blame them for insisting that patients must pay before they are attended.